When I can order flowers on Valentine's Day for my wife from across the planet with a few taps on my phone, I start to expect more from my healthcare. When I can order groceries to my doorstep within 2 hours and anything that doesn't really jive with me, I can get a full refund for, I expect more from my healthcare. When the smartphone app on my phone that gives me the AI chatbot knows all the diagnoses for the constellation of symptoms that I give it, I get to expect more from my healthcare. But I'm a healthcare worker, I'm a family doctor, and we're exhausted. We're not taught how to do team-based care well. We often judge ourselves really harshly, and we beat ourselves up for things that are not really in our control. We're not taught to bridge silos to work with each other. So often when we feel shame, we feel it alone. We burn out in our silos. The leaders in our system, they have no power on their own. The power comes from when leaders collaborate and expand their sphere of influence to join forces for collaborative change. But the budgetary constrictions, the silos of the budgets, the political cycles hamstring their efforts. So change only happens on those small islands. Our health professionals think that their leaders aren't listening. In the boardroom, the power is on the paper, but in real life, the direct care of patients, that's where the power sits. But there's an invisible wall sometimes, and the leaders aren't supported to get there. So people keep having bad experiences, bad human experiences, trauma acquired in the process of seeking care destroys all trust in our system. It generates what's called failure demand, an exponential demand on an already overwhelmed workforce. Our health leaders, they need to be courageous. They need to be curious, risk takers. But instead, they're often sitting scared about the next thing that's going to drop on their heads. So instead of rocking the boat for what we really all need, they sometimes resign themselves to being passive observers in the expensive seats, instead of being the change agents in the arena that we need them to be. But what does kind of give me hope is that we have leaders like the clinicians and the patient partners who are standing up and learning system perspectives. They're learning to advocate. They're learning compassionate leadership. They're learning to speak out for what they see in the system and what needs to change. They're trying to figure out how to collaborate and how to cross silos to make that happen. What gives me hope is that there are leaders who understand that leadership is not about complacency, it's not about comfort or elitism, that it's about collaboration, it's about safety, it's about working together for the quintuple aim for 7 generations. What gives me hope is that there are leaders who willingly give up their spots to raise the voice and to give voice for those with less intersectional privilege, because they know that those voices can spark the change and the will to execute that they can't. What gives me hope is that there are leaders who listen to understand, not to reload. What gives me hope is that there are leaders who will prioritize self-care. They understand that their self-care and their self-compassion fuels their other compassion, and that through kindness and attentiveness, we can spark off virtuous cycles of compassion in our culture. My coach, Dr. Natalie Martinek, she says that when I self-care, I am preserving my empathy that I can then leverage for the hard work of compassionate leadership across silos that we all need to do. When I make sure that I'm well, that my cup is full, I'll be able to pour it out a little bit better. And even those of us who hold resentment for the system, who feel that some sort of martyrdom has been forced on us to bridge the gaps in a system that we're not responsible for, what gives me hope is that there are people ready and willing to reach out and sit with me and hold space with me as I heal and as we build together a new system for the future. What gives me hope is that there are leaders who have a better and fulsome definition of what quality is, not just access, but appropriateness, effectiveness, efficiency, equitability, safety, and respect. That gives me hope. When I was in Quality Academy, I sat with many of you, some of you in my class are here, and we graduated as change agents for this system. That was back in 2018. And now I lead a alumni program for the Doctors of BC's Physician Quality Improvement Program that's graduating more and more change agents across the province. That gives me hope. We're learning things like Duran's Trilogy, which was published 40 years ago, about quality planning, quality improvement, and quality control. And now people in British Columbia are sitting in earnest and thinking about whole system quality. That gives me hope. What also gives me hope is the IHI Open School, where undergraduate students, high school students, medical students, nursing students, they get to learn from compassionate leaders like Dr. Don Berwick. Clap if you like Dr. Don Berwick. Shout out. Dr. Don Berwick, he shares compassion. He knows that when we make mistakes, we're human and that's okay. And he teaches us to speak to ourselves like good friends might speak to us when challenges happen. What gives me hope is that the general public is going to develop critical thinking skills to better suss out between misinformation and good, helpful information. What really gives me hope is that you guys in the room here, you are bringing quality improvement and you are healing healthcare culture. And everybody in this room believes that care for our planet is healthcare. Thank you.